Are you taking amlodipine to control your high blood pressure? If so, I need you to pay close attention to what I'm about to share with you. There are some critical truths about this medication that your doctor may have overlooked, or simply hasn't had time to fully explain. Have you noticed your ankles starting to swell? That uncomfortable, heavy feeling in your feet at the end of the day? Well, that's just the tip of the iceberg, because beneath the surface, there are two other potentially dangerous side effects that amlodipine can cause, effects that could seriously threaten your health if left unchecked. So, here's the thing. You go to your doctor, maybe you've been having some high blood pressure readings, and they hand you a prescription for amlodipine. It's one of the most commonly prescribed blood pressure medications in America. And your doctor probably told you it's safe, effective, all that good stuff. And look, they're not wrong. For most people, this medication works great. But here's what they probably didn't tell you, either because they're rushing through your appointment, or maybe they just don't want to worry you unnecessarily. There are some side effects of this medication that go way beyond what you might expect. And I'm not talking about the usual stuff you read on those pharmacy printouts that nobody ever looks at anyway. I'm talking about real, potentially dangerous things that could sneak up on you. Now, let me guess what brought you here today. You've been taking amlodipine for a while now, maybe a few weeks, maybe a few months, and you've started noticing something. Your ankles are getting puffy. By the end of the day, your shoes feel tight. Maybe your socks are leaving these deep marks around your ankles. You wake up in the morning and everything seems fine. But by dinner time, it's like your feet have blown up like balloons. Sound familiar? Yeah, I thought it might. This happens to about 1 in 10 people who take amlodipine, so you're definitely not alone. But here's the thing that really gets me fired up about this. Most doctors will just brush this off and say, "Oh, that's totally normal. It's just a side effect. You'll get used to it." And you know what? That drives me crazy, because they're missing the bigger picture. See, when amlodipine does its job of lowering your blood pressure, it relaxes all your blood vessels. Not just the big important ones, but all of them, including these tiny little vessels in your feet and ankles. When those vessels relax, fluid starts leaking out into the surrounding tissue. It's like having a bunch of tiny garden hoses with loose connections. Everything's fine when you're lying down at night, but as soon as gravity gets involved during the day, that fluid just pools down in your feet. Now, most people think this is just cosmetic, just annoying. But here's what I want you to understand. This swelling, this edema, as doctors call it, it's your body trying to tell you something. It's like your body's check engine light. And just like you wouldn't ignore that light in your car, you shouldn't ignore this either. But the ankle swelling, that's actually the least of your worries. There are two other side effects of amlodipine that are way more serious, and frankly, they scare the hell out of me because most people have no idea they're even possible. The first one is something called orthostatic hypotension. I know, medical terms, right? But stay with me here because this is important. What this basically means is that your blood pressure can drop dangerously low when you change positions, especially when you stand up. Now you might be thinking, wait a minute, isn't the whole point to lower my blood pressure? And yeah, you're absolutely right. But there's a huge difference between controlled, steady blood pressure reduction and having your blood pressure suddenly crash when you stand up. This isn't just feeling a little dizzy when you get out of bed too fast. This is potentially passing out, potentially falling, and seriously hurting yourself. Here's how it happens. You're sitting on the couch watching TV. Maybe you've been there for an hour or two, and suddenly the phone rings. You jump up to answer it, and wham! The room starts spinning, your vision gets all dark and tunnel-like, and you feel like you're about to hit the floor. Or maybe you're at work, sitting at your desk, and you need to get up quickly to catch someone before they leave. Same thing happens. What's going on is that amlodipine has your blood vessels so relaxed that when you stand up, your cardiovascular system can't adjust fast enough to pump blood up to your brain against gravity. It's like your body's automatic. Systems are running in slow motion, and here's the scary part. This can happen anywhere, anytime. Imagine you're at the top of the stairs at home and this hits you. Imagine you're getting out of your car in a parking lot, and suddenly you can't see straight. Imagine you're at the grocery store reaching for something on a high shelf. 1 minute you're fine, the next minute you could be on the ground with a serious head injury. The warning signs are pretty clear once you know what to look for. Every time you stand up, you feel dizzy or lightheaded. Your vision goes dark for a few seconds. You feel weak or unsteady on your feet. Sometimes, you feel like you might actually faint. If this is happening to you regularly, especially if it started after you began taking amlodipine, or after your doctor increased your dose, this is not normal. This is not something you should just live with. But wait, it gets worse. The second dangerous side effect is something that really blows people's minds, because it seems to go against everything you'd expect. In some people, amlodipine can actually make chest pain worse. Yeah, you heard that right. A heart medication can sometimes make heart problems worse. Now, this doesn't happen to everyone, and it's definitely not common. But for people who already have some narrowing in their coronary arteries, the arteries that feed blood to the heart muscle itself, amlodipine can sometimes create a problem. Here's the deal. When amlodipine relaxes your blood vessels and lowers your blood pressure, that's generally a good thing for your heart because it doesn't have to work as hard to pump blood. But sometimes it can also reduce the pressure that drives blood through those coronary arteries. If those arteries are already narrowed from plaque buildup, which, let's face it, a lot of Americans have, whether they know it or not, then reducing the driving pressure can actually decrease blood flow to parts of the heart muscle. When the heart muscle doesn't get enough blood, that's when you get chest pain, what doctors call angina. So here you are, taking a medication that's supposed to help your heart, and suddenly you're having chest pain that's worse than before. Or maybe chest pain that you never had before. Even more concerning. And this is the part that really keeps me up at night. In some people with underlying heart problems, the sudden drop in blood pressure from amlodipine can actually trigger signs of heart failure. Your heart has maybe been struggling for years, but managing to keep up. And then, when the blood pressure drops, suddenly it can't compensate anymore. So what are the warning signs here? Well, any new chest pain is obviously a red flag. But I'm not talking about the kind of chest tightness you might feel when you're stressed about work or family stuff. I'm talking about real chest pain, pressure, tightness that feels different from anything you've experienced before, especially if it comes with shortness of breath, unusual fatigue, or weakness. Sometimes people describe it as feeling like an elephant is sitting on their chest. Sometimes it's more like a tight band around their chest. Sometimes it feels like heartburn, but it doesn't go away with antacids. If you're having trouble breathing, especially when you're lying down flat, or when you're doing something that shouldn't, be that taxing, like walking from your car into the store, that's a problem. Unusual fatigue is another big one. Not just being tired after a long day, but sudden, overwhelming fatigue that doesn't make sense based on what you've been doing. Your heart is struggling, and fatigue is often one of the first signs. And if you notice your heart beating irregularly, racing, fluttering, skipping beats, especially if this is new since starting amlodipine, you need to pay attention to that. Now, if you're experiencing any of these symptoms, especially the chest pain, shortness of breath, or severe fatigue, this is not something you wait and see about. This is not something you Google and try to figure out on your own. This is get in the car and go to the emergency room territory. I don't care if it's the middle of the night. I don't care if you're worried about the cost. I don't care if you think you might be overreacting. Better to be safe than sorry. Look, I want to be really clear here. I'm not trying to scare you away from taking amlodipine if your doctor prescribed it. For the vast majority of people, this medication is safe and effective. Millions of Americans take it every day without any serious problems. But what I am trying to do is give you the information you need to be smart about it, to recognize when something's not right, and to advocate for yourself in a healthcare system that's often too rushed to give you all the details. The reality is, your doctor probably sees dozens of patients every day. They're under pressure to keep appointments moving. They might have 15 minutes with you, and in that 15 minutes, they need to check your blood pressure, maybe do a quick physical exam, answer your questions, and get you out the door so they can see the next person. It's not that they don't care, it's just that they don't have time to go into all the nitty-gritty details about every possible side effect. That's where you come in. You need to be informed. You need to know what to watch for. And most importantly, you need to speak up if something doesn't feel right. So what do you do if you're dealing with that ankle swelling I talked about earlier? First thing, talk to your doctor. Don't just suffer through it thinking it's something you have to live with. There are options. Your doctor might be able to adjust your dose, switch you to a different blood pressure medication, or add something else to help with the swelling. In the meantime, there are some things you can do that might help. Elevating your legs when you're sitting around watching TV or reading can make a big difference. Just prop them up on a pillow or ottoman so they're higher than your heart. Even doing this for 15 or 20 minutes a few times a day can help that fluid drain back up. Movement helps too. I know it seems weird when your feet are already swollen, but gentle exercise actually helps your body pump that fluid back up. Take a walk around the block, walk around your office building. Just get those calf muscles working, because they act like pumps. Watch your salt intake. Yeah, I know, easier said than done when you're living in America, where everything is processed and loaded with sodium. But excess salt makes your body hold on to fluid, which just makes the swelling worse. Try to cook at home more often. Read labels. Ask for no added salt when you're eating out. Some people find that compression socks help. You can get them at pretty much any pharmacy, and they provide gentle pressure that helps prevent fluid from pooling in your legs. Just make sure you get the right size and compression level. If you're not sure, ask the pharmacist. Stay hydrated. I know it sounds backwards when you're already retaining fluid, but if you're dehydrated, your body actually holds onto fluid even more. So drink water throughout the day, just don't go crazy with it. And here's something a lot of people don't know. The timing of when you take your medication can sometimes make a difference. Some people find that taking amlodipine at bedtime instead of in the morning helps reduce daytime swelling. But never, and I mean never, change when you take your medication without talking to your doctor first. Now, if you're dealing with dizziness when you stand up, that orthostatic hypotension I talked about, there are some strategies for that too. Your doctor might need to adjust your dose or change your blood pressure target. Sometimes taking the medication at night instead of in the morning helps, because the peak effect happens while you're sleeping instead of during the day when you're up and moving around. You can also learn to change positions more slowly. Don't jump up from the couch. Sit on the edge of the bed for a minute before you stand up in the morning. Give your cardiovascular system time to adjust. But here's the thing. While you're working with your doctor to figure out the medication side of things, there are some practical things you can do right now to take better care of yourself. Keep track of your symptoms. I'm not saying you need to become obsessive about it, but just make mental notes or jot things down about when the swelling is worse or better, what activities seem to help or hurt, any other symptoms you notice. This information is gold to your doctor when they're trying to figure out the best treatment plan for you. If you have a scale at home, weigh yourself at the same time every day, preferably first thing in the morning after you use the bathroom and before you eat anything. Sudden weight gain can be a sign that you're retaining more fluid, and that might mean your medication needs to be adjusted. Listen to your body. You know yourself better than anyone. If something feels off, if something feels different, trust that instinct. Don't let anyone dismiss your concerns or make you feel like you're being dramatic. And please, please don't ignore the serious warning signs. Severe dizziness, fainting, new chest pain, worsening chest pain, trouble breathing, overwhelming fatigue. These are not things you tough out. These are not things you wait until your next scheduled appointment to mention. These require immediate medical attention. Look, I get it. Nobody wants to be that person who's always running to the doctor for every little thing. Nobody wants to spend hours in the emergency room just to be told everything's fine. But when it comes to your heart, when it comes to your cardiovascular system, it's better to be safe than sorry. Here's what I want you to take away from our conversation today. Amlodipine can be a really good medication for controlling blood pressure. It's helped millions of people avoid heart attacks and strokes. But like any powerful medication, it demands respect and attention. That ankle swelling isn't just a cosmetic issue. Those dizzy spells aren't just something you have to live with. And any chest pain or breathing problems are definitely not normal. Side effects you should ignore. Work with your healthcare team to find the right balance between controlling your blood pressure and maintaining your quality of life. Don't be afraid to speak up if you're uncomfortable with side effects. Don't be afraid to ask questions. Don't be afraid to get a second opinion if your current doctor seems dismissive of your concerns. The goal here isn't just to get your blood pressure numbers to look good on paper. The goal is to improve your overall health and help you live a longer, better life. If a medication is making you miserable, if it's interfering with your daily activities, if it's causing scary symptoms, that's a problem that needs to be solved. You are your own best advocate in the healthcare system. Stay informed, stay alert, and never hesitate to seek help when something doesn't feel right. Your health is worth fighting for, and you deserve to feel your best while managing your blood pressure. Thanks for listening today, and remember, knowledge is power when it comes to your health. Take care of yourself out there.